welcome. All right, we'll wait a few minutes for everybody to come in. Come on into the broadcast. Welcome. I'm Dr. Melva, your board certified radiation oncologist, and we are broadcasting live today. Today is Thursday. It's September the 28th, 2017, and it's 6:30 p.m. Eastern. We're broadcasting live, so come on in. We'll wait for everyone to join us tonight. When you're here, say, hi, I'm here. If you're catching me on the replay, thank you so much for watching the replay. Remember to share. Sharing is caring. I'm Dr. Melva, your board certified radiation oncologist. Tonight we are talking about diarrhea, and I have my notes right here. So we're going to get into diarrhea, okay? Hopefully you've already eaten for today, but that's our topic for today. Welcome to the live broadcast. Thank you so much for joining. I'm Dr. Melva. We'll wait for people to join as we wait for Facebook to get that audience together. Just move this a little bit. Let me know that you're here. I'm broadcasting live from Chesapeake, Virginia today. Hope everybody is doing well. All right, so let's get going. All right, welcome to the broadcast. I'm Dr. Melva, your board certified radiation oncologist, and I help people that have been diagnosed with cancer through my videos, speaking, second opinion consults, and community cancer centers. I help patients that have been diagnosed with cancer navigate the cancer care system, coordinate care, and live a normal life in spite of cancer. And you can find me right here on facebook.com/Dr. DOCTOR Melva, MELVA. Welcome to the broadcast. Thanks so much for joining today. Today we are having Cancer Chat with Dr. Melva, and we are talking about getting your digestive tract back on track. Volume 2. If you missed it last week, Volume 1, we did nausea and vomiting. This week we're talking about diarrhea. All right. It's not pretty and it's not fun to talk about, but it is one of the most common side effects that my patients experience either while on treatments with chemotherapy, immunotherapies, or undergoing radiation, mostly to the pelvis area. So if you're just joining us, say, hey, Dr. Melva, I'm here and I'm ready to learn. We're talking about diarrhea, one of the side effects. So how can you get your digestive tract back on track? So first of all, diarrhea is loose stools, really watery stools. It can often affect your quality of life. So if you have uncontrollable diarrhea where you don't know when or how fast it's going to come, you may not want to leave your house. That's a common feeling that a lot of my patients have. So it affects your quality of life, one. And two, it can affect your overall well-being because we're talking about diarrhea today. Thanks so much for joining the live broadcast. When you have diarrhea, one, you may not want to leave the house. Two, you may not feel good. And three, you have to watch what you're eating and what you're doing. So let's get into how we can help you if you have diarrhea during treatment. So one, we said diarrhea can decrease your quality of life because you may not want to leave the house. You may have an accident that could be embarrassing. You may want to just stay by the toilet, which is no fun. So the standard treatment for diarrhea, medication-wise, is usually loperamide or Imodium over the counter. So you can also ask your doctor for other medications. Before asking about medications, always make sure that if you're allergic to any medications, that your doctor knows that before he or she prescribes the medication. Very important. But the first standard medication usually is over-the-counter Imodium or loperamide. But I like to talk about what we can do with our diet and nutrition to also treat diarrhea. And okay, sorry about that. I didn't put my phone on airplane mode. Sorry about that. So we're talking about diarrhea. If you're just joining the live broadcast, this is Dr. Melva. So first we talked about diarrhea impacting your quality of life. One of the first treatments that you may be prescribed by your doctor is Imodium or loperamide, but I like to talk about nutrition and treatments that you can also do naturally. So we're going to have to change our diet a little bit when we have diarrhea, okay? So we need to eat a low fiber, lactose restricted, so low dairy meal, okay? And then you're going to want to avoid raw vegetables because it's harder for the body to break down raw vegetables. So for example, you're not going to eat broccoli or cauliflower if you have diarrhea. You're not going to eat a lot of salad when you have diarrhea. Bran, the skin of fruits, so like the skin of an apple. Any products containing lactose, so that's milk or heavy yogurt, just depending on what it is. But really you want to stay away from the lactose, okay? And you want soluble fiber because that can help with the diarrhea because we want to bulk up our stools. So we want to make them thicker so that we don't have watery stools. Thank you so much for joining the live broadcast. We're talking about diarrhea today. So diet changes for diarrhea. So we want to eat low fiber, lactose restricted foods. Okay, number one. So some of those examples, stay away from things like raw fruits and vegetables. So stay away from broccoli, cauliflower. You don't want to eat the skin, no brands, no salads. And then you want to stay away from lactose. So we're not going around drinking milk when we have diarrhea. And then you want to do something that will bulk up your stool. Welcome to the broadcast. Welcome to the broadcast. We're talking about diarrhea today and getting your digestive tract back on track. So if you are experiencing diarrhea, one, your doctor may prescribe a medicine. So loperamide or Imodium is one of the most common, but there are other ones. So talk to your doctor about that. But nutrition-wise, you can moderate and change your diet. So eating low fiber, low lactose foods. And then next, number 3, probiotics. So there's a lot of literature, a lot of data on the internet. A lot of my patients are learning about probiotics. Probiotics can help with diarrhea as well. Okay? And if you are having a lot of diarrhea, another concern that I have and another common problem is that you may end up getting admitted because you're drying your body out. Or the other word for that is dehydration. So it's very important that you're drinking drinks that replace what you're losing from behind, okay? So when you have a lot of water coming out of your stools or really loose diarrhea, it dries and sucks everything out of your body. So what you want to do are to have healthy drinks that have what we call electrolytes. So Gatorade's one of the most popular. I don't know if that's my favorite one because it has a lot of sugar in it, but you want to drink a drink that has electrolytes so that we bring this water and this moisture back into your body, okay? Because we don't want your body to lose anything. All right, so quick and dirty on diarrhea. Volume 1, if you missed it last week, check out that episode. We talked about nausea and vomiting, what you can do, and this is the series on getting your digestive tract back on track. And today we talked about diarrhea. I hope this is of value to you if you're going through treatments with chemotherapy, immunotherapy, or radiation treatments, or you may have gone through treatments before and had problems with diarrhea. So just to recap again, when you have diarrhea, let your doctor know so that we can follow your side effects. 1, you may be prescribed a medication. The most common one is Imodium, or loperamide is another name. Make sure you're not allergic to any medications. 2, we can change our diet. So we're going to do low fiber, low lactose diets. Okay, so we're avoiding raw foods and vegetables. Number 3, probiotics may help. And number 4, you want to make sure that you're staying hydrated and that you're replacing your electrolytes. Hi, Lynn. Thanks so much for joining the live today. Thanks so much for joining. All right, so this is going to wrap it up for today, volume 2 with diarrhea. Let me look and see if there are any comments. I hope you all got value from this. Please make sure that you share because sharing is caring. All right, so let's see if we have any comments. All right, so if there aren't any comments, you can catch me right here on Dr. Melva, Facebook.com/Dr. DoctorMelva, MELVA. I'm here live weekly on Thursdays at 6:30 p.m. Eastern. Next week, we will be doing volume 3 of getting your digestive system back on track, and we'll be talking about constipation. So we did diarrhea this week. Next week, we're going to do constipation. If you're getting value from these, please let me know, and please share because sharing is caring. And for those of you just joining, I'm Dr. Melva. I'm your Board Certified Radiation Oncologist. Hi, Maria. Thanks so much for joining. Thanks for joining the broadcast. I'm your board certified radiation oncologist, and I help patients that have been diagnosed with cancer through my videos, speaking, community cancer centers, and second opinion telemedicine consults to navigate the cancer care system, take back control of their lives, and live a normal life in spite of a diagnosis of cancer. Until next time, we'll see you. Bye. Thanks for joining.